Exercise psychology and sports psychology are areas of study concerned with behavior, thoughts, and feelings of healthy, disabled, and diseased individuals engaging in physical activity, exercise, sport, and athletic competition. Both exercise psychology and sports psychology use the educational, scientific, and professional contributions of psychology to help understand the mental aspects of physical activity, exercise, sport, and athletic competition. This picture describes the conceptual framework of exercise and sports psychology. Studies in these areas may include enhancing an exercise program adherence or reducing anxiety and depression associated with participation in a cardiac rehabilitation program, having concern with developing methods for enhancing exercise adherence, self-esteem, and leadership, or having personal trainers working with individuals to promote improvement in psychological well-being as well as performance during training and competition. Some definitions to know when discussing sport and exercise psychology.
Cognition is the mental faculty of knowing, which includes perceiving, recognizing, conceiving, judging, reasoning, and imagining. Perception is the recognition and interpretation of sensory stimuli based chiefly on memory. Objective is interpretation of facts based on an observable phenomenon. Hypnotic catalepsy is a state of physical rigidness induced by hypnosis. Constructionist approach is the belief that individuals construct new knowledge from their experiences. This is when considerable emphasis is given to the individual's subjective experience. The self-report, using standardized questionnaires or physiological inventories, is the predominant research and analytic strategy used in both exercise and sport psychology. Most of the questionnaires measure specific forms of thought, feelings, or behaviors.
Early writings by the ancient Greeks extolled the virtues of a strong relationship between the mind and the body. It was not until the 19th century, however, that a fundamental knowledge based in exercise and sports psychology was established. Most of the significant developments of exercise and sports psychology have occurred since the mid-1960s, leading to exercise and sports psychology emerging as a professional area of study in exercise science. Early work establishing relationships between the mind and the body was largely a result of individuals trained in psychology examining factors related to physical activity and exercise. For example, in 1884, Conrad Rieger published what is considered to be the first article related to psychology and exercise, in which he reported that the mental state of hypnotic catalepsy enhanced muscular endurance.
Norman Triplett published the first true experimental study that was directly related to exercise and sports psychology. He was interested in how direct competition between two individuals affected performance. We tried this experiment ourselves.
Like Triplett observed, we noticed that when two individuals compete against each other, a social factor seemed to motivate individuals to perform better than that was not observed when individuals performed alone. In the early 20th century, several scholars studied various relationships between physical activity and sport and the responses of the brain and the nervous system. In 1908, the president of the American Psychological Association, G. Stanley Hall, highlighted the advancements in these areas in a report that described the psychological benefits from participating in physical education.
Throughout the 1940s and 1950s, research in the areas of physical activity, exercise, sport, and athletic competition examined personality traits in athletes, emotions and stress related to youth sport competition, college athletic performance, competition, motor performance, and exercise.
Professional organizations also emerged in America to help promote exercise and sports psychology. The first meeting of the North American Society for the Psychology of Sport and Physical Activity occurred during the 1967 American Alliance for Health, Physical Education, and Dance National Conference.
During the mid-1980s, there was a shift in the research and application interests of many exercise and sports psychologists. This shift in research intended for less laboratory activities, to more field-based experimentation and practice. As a result of this movement, the formation of the Association for Applied Sports Psychology was established in 1985. This table lists significant events in exercise and sports psychology dating all the way back to 1884. Other definitions to consider when referring to exercise and sports psychology are self-efficiency, an impression that an individual is capable of performing in a certain manner or attaining certain goals; self-concept, the sum total of an individual's knowledge and understanding of his or herself; and self-esteem, the way individuals think and feel about themselves and how well they do things that are important to them. Study of the body and mind when referring to sport and exercise correlates to behavioral psychology. Three primary objectives linked to behavioral psychology includes understanding the social psychological factors that influence individual behavior, understanding the psychological effects delivered from participation, and enhancing the experience of individuals prior to, during, and following participation.
Directly relating to behavioral psychology is one's own personality. Personality is defined as the entire qualities and traits, including character and behavior, that are specific to someone. Individual personality plays an important role in the behaviors that individuals exhibit during participation in physical activity, exercise, sport, and athletic competition. Personality research in exercise and sports psychology has been a popular area of study and underlies much of what exercise and sports psychology professionals study.
Our two questions are, in the mid-1980s, what shift in research was applied for exercise and sports psychologists? Our second question is, personality belongs to which branch of psychology?